This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program, Mon Health Talk. Dave Wilson with you. We're going to be talking about celebrations this morning. Hang with me here. It all makes sense in just a moment. Our guest this morning, Dr. Krystal Atkinson, Chief Administrative Officer and Chief Nursing Officer of Mon Health Medical Center and Chief Nursing Executive of the Mon Health System. Dr. Atkinson, good morning. Good to have you back.
Thank you so much. Good morning to you.
And Katie Davison is with us, Chief Human Resources Officer for the Mon Health System. Katie, good morning.
Good morning. Glad to be here.
Well, this week is Nurses Week. Next week is Hospital Week, and we're going to be talking about both of those coming up on the program this morning. And before we get to that, you must talk about yourselves a little bit, because who doesn't enjoy talking about themselves, at least for a couple of minutes? We'll start with Krystal. We'll start with you, even though I know you've been on the show multiple times now. Just give us a reminder about your background, where you're from, where you went to school, and how you ended up working with Mon Health.
Oh, absolutely. So I am a native of Richmond, Virginia, and I went to school. My last degree was Old Dominion University. I have a doctorate in nursing practice, and I've been a nurse for a long time, but my specialty was in the operating room, just an area that I absolutely love even today. So it was certainly something that spoke to me when I was in nursing school, and I had a fantastic opportunity for years working in the OR.
And Katie, tell us a little bit about your background.
Sure. And I am from Seattle, Washington, went to the University of Washington, where I majored in political science and kind of fell into HR as a career, but absolutely loved it, and I spent 11 years in North Carolina before relocating to Morgantown. And my husband is a tried and true mountaineer, and so it was like coming home for us. So very grateful for the opportunity, and now I've been in West Virginia for 4 years.
Katie, I got to ask, since we're in the midst of political season, a poli-sci major, were there some thoughts when you picked that major? Maybe you were going to get in running for office or something like that back in the day?
No, it was more of I think at the time I had thoughts of going to law school, and very quickly learned there were multiple things that I could do with the degree, and have shifted to being more focused on people and culture and using that to my advantage as we navigate policies and benefit practices. And so trying to put that degree to the good side of the politics side.
That's the good side. Well, thank you guys for both joining us here. As I mentioned, it's a big month for healthcare celebrations. Nurses Week this week, next week, Hospitals Week. Krystal, what is Nurses Week all about?
You know, it's a great opportunity to be able to celebrate our nurses across all specialties. Throughout the year, each individual specialty has their week of celebration. But this week really culminates all of the areas together, and it gives us the opportunity to celebrate everybody across the organization and their specialties.
And Katie, when I say Hospitals Week, what are we celebrating during Hospitals Week?
So Hospital Week is a nationally recognized holiday, and it really goes to showcase that it takes a village to run a healthcare organization. So it's about celebrating all of the different professions that work so hard each and every day to not only care for our patients, but keep our operations going. So it's a wonderful way that we can celebrate and recognize all of our employees and thank them for what they do.
And Dr. Atkinson, being the Chief Nursing Officer with Mon Health and your career as a nurse, what does it mean to have Nurses Week and have this opportunity to recognize those working in the nursing profession?
You know, it really is a fantastic opportunity really to take a time out. You know, we get so much positive feedback from our patients, you know, from other areas in the hospital celebrating our nurses, but to have a full week that's been designated to set aside to look at the small things that nurses do to the large things that nurses do each and every day is super special.
You know, Krystal, I've thought about this a couple of times when I've had conversations with you on this program. The men and women who are working as nurses probably have such an impact on the patients. I can remember when my grandparents had to be in the hospital, one thing all of them talked about was the nurses who came in to check on them, to check on this and that, and how much they like this nurse and how much they like that nurse. And it made such an impact and a difference while they were having, whatever they were having to deal with there during their hospital stay. But that has to be gratifying on some level, satisfying on some level. Is that a fair statement?
Oh, very fair statement. I think that when, at the end of the day, when you go home and you think about the long days, I mean, our nurses work, 8 hours, 10 hours, 12-hour shifts. And when they have that moment when somebody just says, thank you, it really touches your heart. It really just speaks to your spirit of why you're doing what you're doing. So that is extremely gratifying.
That was actually going to be my next question, was how far does a simple thank you or pat on the back or just getting that little bit of appreciation from somebody go? Because obviously it's a very difficult job. The challenges have been well documented, I think, over the last especially 4 years with what's been going on in the healthcare industry. How far does that go just to get that pat on the back sometimes?
It goes a long way, whether it is, us recognizing our teams, hey, thank you for a job well done, or a family member or a patient just saying, thank you, you treated my mom so well, I appreciate everything that you're doing. It's that small gesture, and people may not think that it means a lot, but it really does have an impact. So
are there any events planned this week, celebratory cake or something to recognize Nurses Week?
Oh, let me tell you, we've had a full team working on different themes. This morning we started out with a nifty 50s breakfast. We have a fantastic director of engagement, Nate James. He is wonderful. So he has worked with us throughout the week to be able to make sure that not only this week, but next week as well, we have something themed every day. Our team loves to be able to we have support animals that come in, and they support not only our patients, our service animals, but also our nursing staff. Our hospital staff in general love to be able to get a visit from Stormy, the miniature horse. So we have a lot of different activities. We have lunches. We have just great opportunities, a spa day, opportunities just to really give back and give them an opportunity to take it all in.
Dr. Krystal Atkinson, Chief Administrative Officer and Chief Nursing Officer for Mon Health Medical Center, joining us along with Katie Davison, Chief Human Resources Officer for Mon Health System. This week is Nurses Week. Next week is Hospital Week. We're going to talk about that on the other side of this break. You're listening to Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning, Dr. Krystal Atkinson, Chief Administrative Officer and Chief Nursing Officer with Mon Health Medical Center, and Katie Davison, Chief Human Resources Officer for the Mon Health System. We talked about Nurses Week this week. Katie, next week is Hospital Week, and how will Mon Health be celebrating Hospital Week?
Well, we have something planned each and every day, and more importantly, each and every shift. I think what's important to recognize is that hospitals are 24/7 operations, and that's not only for our clinical staff, but many of our non-clinical staff as well. So it's very important for us to have events that happen for every single individual. So we are doing a number of items related to rounding with ice cream, having cupcakes, but also doing some fun things to help with kind of wellness and mental health. We have a painting class that we're doing, some yoga sessions. But one of my favorite items is that we partner with local schools, and we have children draw thank you notes and pictures for the healthcare staff, and we post those in all areas of the hospital. So it's just a great reminder that our staff are not only appreciated by the leadership here at the hospital, but also by the community.
Can you give us an idea? Like you mentioned, hospitals are a 24/7 operation. Outside of the clinical staff that many people probably think of when they think of hospitals and the healthcare industry, some of the jobs and some of the roles that are essential to making certain a hospital and a healthcare system function so you never notice these folks doing their jobs?
Absolutely. I think the IT department is a perfect example of you don't notice them because when everything's working, right? So
right.
They are so critical to our electronic medical record system running, our payroll and HR systems running, all of the different equipment that has an IT component. I think our facilities team is another great example of those who work behind the scenes but are so critical to the success of the organization, making sure we have proper airflow, that things are repaired in a timely manner, whether it's a patient's bed being comfortable and being able to raise up as needed, fixing the ice machines, those types of things. And then also our departments like our lab, our imaging services that work so diligently to get images produced, to process lab results, so therefore the clinicians can then make appropriate recommendations for the care of our patients. It really does take everyone working in tandem, and we couldn't do it without those areas.
And Katie, here's a quick opportunity for a recruitment pitch. Speaking of those types of jobs, you think healthcare industry, you think careers, and it doesn't have to be a doctor, physician, surgeon, nurse. There are a lot of career opportunities that I don't want to say have nothing to do with healthcare, but utilize certainly a different skill set, right?
Absolutely. We're like our own little city here where we have everything from accountants, security officers, dietitians, you name it. You can find it here at the hospital. And that's been very important with us as we go to recruit our also next generation workforce. We're very engaged with middle schools and high schools and helping them learn that there are so many more opportunities to working in healthcare that go beyond just the bedside of being a nurse or a doctor. So that's very important to us as well, is making sure that people understand we have opportunities here. And so it's a great place to work. We actually won the Best Place to Work and Best of Morgantown this year. Very proud of that. And the reason is because of our people.
And Dr. Atkinson, bring you back into the conversation. It's Nurses Week, so you're celebrating with events and things throughout the week. But do you take time throughout the other 51 weeks of the year to say thank you or recognize the work that the nurses do?
Absolutely. I mean, that's really a theme for all of our leadership team. It's again, like we talked earlier, it's the small things. It's just saying thank you. It's just being present. Sometimes it just is a listening ear. That goes a long way, whether people want career advice or they have a, challenging situation on their unit. It's a small effort to be present and to be available when people need you.
Same question to you, Katie. Outside of hospital week, do you take some moments throughout the year just to say thank you?
Oh, all the time. It's a big part of who we are is recognition. And I think it's just as important as we often seek feedback of what could we do better as an organization. It's also great to hear what we're doing well so we can sustain that. So we have awards that we recognize staff based on our I Care values. So people that exhibit those values can win a variety of rewards and recognition. We also have what we call Monstars, where we can recognize groups that go above and beyond. And then just simple things like sending thank you cards. I have to give Krystal credit. She hand writes thank you cards to every single nurse in our organization. And it's something where whether it's just a moment that you say thank you verbally or sending a card to individuals, again, recognizing and seeing what they do each and every day really does go a long way.
That is a lost art form, Krystal. Kudos on the handwritten cards there. Before I let both of you go here, we're coming up on the top of the hour. Krystal, we have in West Virginia, we need nurses. We need more nurses. So if you are a young person considering a career, here's your recruiting pitch, I guess. Why is the nursing profession one to consider, one that could be a very rewarding career for someone?
Well, as Katie talked about being our own little city, you can look at that throughout nursing. Every aspect of what we do, there's a niche for somebody, and there's a calling. So it may not be that might not be the person that wants to work in the ICU, but you may be the person that may be working with IT. We have nurses that work in IT. You need that specialty. We have nurses that work throughout the organization in different areas, and it's a great opportunity to expand your mind. We have such great work that we're doing with our younger people to be able to get that exposure that they just don't see all the time. And so here's an opportunity to be able to explore. There's certainly an opportunity here for you at Mon.
And Katie, same question, just a little bit different for, again, people who maybe they're looking for a career change, maybe they're getting ready to start their careers. Why give the healthcare industry a look?
I think because it is an industry that is evolving. It's something where we have a need in multiple areas, but I also think it's important because of our mission. And it's something where if you're in a career that maybe you're feeling like, why do I go to work every day? I can honestly say that no matter what your position is here at Mon Health, you make a difference, and that's in a patient's life, a family member's life. And no matter what your role is, you're touching some aspect of patient care. And to me, that's what gets me out of bed in the morning. That's what motivates me to come to work, is knowing that the work that I do matters and matters in our community.
Dr. Krystal Atkinson, Chief Administrative Officer and Chief Nursing Officer of Mon Health Center and Chief Nursing Executive of Mon Health System, and Katie Davison, Chief Human Resources Officer for Mon Health System. Thank you both for taking some time and joining the show today. I appreciate it very much. Happy Nurses Week and happy Hospital Week, guys. Thank you so much.
Thank you so much for having us.
Absolutely. I appreciate it, and, of course, give my best to all the staff there at Mon Health.